Hello, my name is Pat Bohse and welcome to SCAN. SCAN stands for Social Community Activities Network, and we have been providing service in Monmouth and Ocean counties for the last 26 years. It is my pleasure to introduce Sue Skola, who's the Executive Director of the Beacon Health and Social Service Agency, and who will be talking to us today about PACE, a program of all-inclusive care for the elderly. Welcome.
Nice to be here with you, Pat,
It's
today.
nice to see you. And again, I see you a lot. I mean, other than being on the show, you're on our board of directors as far as SCAN.
Correct.
And you've been a wonderful asset and helped me as the years have gone by so quickly. But before we get talking about PACE, tell me a little bit about yourself.
Well, I'm a registered nurse by profession, and I have more than 30 years experience in nursing. And I kind of moved along the administrative track. I worked at Monmouth Medical Center for 28 years. I had many different jobs there, and from nursing management to case management to administration. And I left there about a year and a half ago with the opportunity to get involved in a new type of a program that had the potential for Monmouth County, and that is a PACE program, which is what we're going to be talking about today. At the time, I didn't really know what it was myself, so did some research and made the decision to make a move and to work with the company Acute Care Health System in developing and implementing the PACE program under Beacon Health and Social Services.
So I think they made a fabulous choice.
Thank you.
And again, I know a little bit about PACE programs because there are only a few in New Jersey, but there are systems throughout the country. So tell us, what is PACE?
Well, as you mentioned, PACE is a program of all-inclusive care for the elderly. And the whole concept is that you can provide an all-inclusive package to specific individuals that meet certain criteria, and these tend to be the frail elderly. And in lieu of a standard insurance package, in lieu of dealing with Medicare and Medicaid separately, the insurer piece becomes combined to really be able to provide more services to an individual that meets criteria. And we're talking about dealing with the frail elderly.
Okay. Philosophy and history of PACE? Because again, PACE has been around for a while, but in other locations.
Yeah, well, the philosophy is really to develop a model that's centered around trying to keep elderly individuals living at home, living safely at home by providing an all-inclusive package of services. Avoid having to go into a nursing home, maybe not at all, or at least not for a while, if an individual is at that level of care. The whole idea is really supporting seniors to improve their quality of life and to work with families and their support team, caregivers as a unit, so that these folks can really have a better quality of life in their later years.
So how long has PACE been, a PACE type of program been around?
The PACE actually started as a pilot project under Medicare back in the late 70s, early 80s. And it became a model that they started allowing programs to open up under a waiver in the 90s in different states. And then with the Balanced Budget Act in 1997, it was approved as a program under Medicare and then at the state level under Medicaid. And at this point, there's about 120 that are throughout the country in about 32 states. There is 4 in New Jersey that you had mentioned earlier, and they've been in existence for about the last 5 years.
Okay, and so this is my definition of PACE. Maybe it becomes really a one-stop shopping for the people who are eligible and who sign on to PACE, meaning that you provide all of the care that they need.
That's correct. We become their primary care provider, so we have a physician that would be their primary care provider. And then the one-stop shopping is that we have a full interdisciplinary team that works for the PACE program, which includes nursing, social work, physical therapy, occupational therapy, nutrition, pharmaceutical services, transportation is part of the program, recreation, so that the team really works with the individual that wants to enroll and their family to bring, develop a plan of care that's appropriate for them.
Now, do they come to you, or do you go to them, or both?
Both. We do have a center, which is basically the hub of the operation. There'll be a PACE center. And all of the PACE programs, they'll have that center. It's typically where all of the services that can be provided there are, which includes a clinic, includes daycare activities, includes meals, transportation to and from. But the unique feature of the PACE program is that you have the center where they can come for some of those services, but you also become their insurer. So under Medicare and Medicaid, or if there's private pay portion, these individuals are able to receive the care at the center and at home, but the PACE program really becomes responsible for them 365 days a year,
Wow.
24/7. So the program has to have in place a system to be able to address all of their needs. There's maybe home care component to it, if they need supportive services through home health aides, evaluations in their home in terms of safety of their home, and really addressing them on an ongoing basis. So although the PACE program itself becomes a primary care provider, they have to have a network developed of other providers that person may need. So all the subspecialists, if they need to go to the hospital, if they do need subacute level of care, or they do need a nursing home at some point in time, any kind of other home care services that they may need, under the PACE model, would be responsible to provide those services under what typically is covered under Medicare and Medicaid.
And that's really very exciting, again, especially for family members and for seniors who don't have to then go through the system, individually and try to put all those pieces together, because it's packaged.
Yes.
And basically they're taken care of in a really nurturing environment, and they can stay where they want to be, and that's usually they want to be home.
Mm-hmm.
So that's really exciting. I'm excited that it's coming to Monmouth County.
Yeah.
So who's eligible for PACE?
Okay, the eligibility criteria is simple, but it is what it is. 55 and older. Basically, the individual would need to meet the state definition of nursing home level of care. And that means that the individual would need assistance with at least 3 activities of daily living. They may include feeding, they may include toileting, bathing, dressing, things that you take for granted every day that some of these folks really struggle with. So that basically is a definition by the state that individual could qualify to be in a nursing home. So again, trying to keep them out, they would need to live in a safe environment. They could be living at home, they could live in a senior housing environment, they could live with children, they could live with their spouse, they could live alone. But the whole idea is that the environment is a safe environment as evaluated by the team. And then they would need to live in a specific service area. So the PACE programs that are approved by Medicaid and Medicare are designated to specific service areas. So for the program that will be coming in Monmouth County, the individuals would need to live in one of the 50+ zip codes that have been assigned within Monmouth County.
And at some point, we'll know what those are.
Yes.
So outreach can happen. We've already talked about the types of services. Who are you partnering with? I mean, is that are they members of your team? Are they working with you, or are they other community partners that you're going to be contracting with to provide some of those services?
Yes, as I mentioned before, as the insurer, we're responsible to have a full provider network. We're working with Monmouth Medical Center, and you know, based on our location as well as where folks would be living in Monmouth Medical Center. So, you know, we have to have hospital contracts, and then the various physicians that are in Monmouth County of all the different specialists, backup for some home care.
Okay.
And then we want to tie in the education component. You know, futuristically, we want to look at what are the educational needs of the participants, of our care providers that working with, whether it be the local schools, universities, and then of course working with SCAN.
We're excited.
Who I've been involved with for many years, being part of Monmouth and part of the geriatric program at Monmouth. Have worked with SCAN and absolutely will be partnering.
Perfect. So again, we've talked about some of the services. Do you want to talk a little more about members of your interdisciplinary team that are part of PACE, that are part of your whole system?
Sure, sure. We have a physician who will be the medical director and initially be the primary care physician. So, you know, as a PACE program grows, then additional physicians or nurse practitioners, you know, would come on board. There's a nursing component that includes home care as well as visits in the clinic. The clinic is located in these centers. There is physical therapy and occupational therapy. They would be involved in maybe doing an assessment in the home for safety, doing an equipment assessment as far as what an individual may need, assistive devices and things of that nature that can, again, make that home setting a safe environment, as well as outpatient therapy can be done in the center. There's a gym that's there. Wow. That will, you know, that they can get exercise therapy and other types of therapies as an outpatient on days that they may come to the center. There's a nutrition component, and at the center, meals are provided, but the nutritionist is also responsible to really evaluating the dietary needs of the individual, ensuring that they have the ability to have meals when they're not at the center, because
Right.
again, these are folks living at home. So time spent in a PACE center is very limited compared to 24/7, 7 days
Yeah.
a week. So, you know, do they have the systems and the resources in place to assure that they eat when they're at home? Pharmaceuticals, I mentioned before, that's an extremely important component with this population. Many of these individuals are on more than 7 to 10 medications a day. They get confused about when to take them, what they're taking them for, and the idea of developing a program with a pharmacy that packages the medication in a way that it's very easy to follow the directions,
Great.
that they can take them when they need them. I mentioned transportation as well. So we would need to provide transportation to and from the center, as well as if the individual needed any other medical visits with another specialist, or they needed to go for a diagnostic test, then transportation would be provided as well for that.
So you've been talking about the center. Can you share where the center might be?
Yes, we're planning on the center is going to be in Oceanport at Fort Monmouth. There's been a purchase of the Army Patterson Hospital, for those that are familiar with the area, and the owner has purchased that building as well as surrounding land in that site. And there'll be multiple things that will be done at that site, but the first phase was to create a PACE center. And there's very specific requirements under Medicare and Medicaid as to what you need to have in a center. We're fortunate enough to have 22,000 square feet.
Wow.
So it's really, really big, and they kind of gutted the area and built it back up from scratch as much as could be. So there's a kitchen there, a warming kitchen where meals will be brought in, as well as meals can be provided from there. There's a huge day center where people can eat, as well as recreational activities can occur. There's the rehab gym that I mentioned earlier. There's also a daycare area to work with folks with dementia or Alzheimer's that really can't be part of a larger group that is set up specifically for them. that will also, they will have recreational activities that are appropriate for them. There's personal care areas, so if an individual isn't able to bathe themselves or take a shower or do their personal care, then that can be incorporated into their plan, and we have full shower facilities there for that. Laundry, if they need assistance with laundry, or they have a problem that day and you need to do a load of laundry. And then the clinic, as I mentioned, so we have a full clinic there with exam rooms, blood drawing station.
So it's a home away from home?
Yes, and then administrative area, so it's really been laid out very, very nicely.
Wonderful. I can't wait to see it.
Yeah.
So one of the last questions is, how is it funded?
Okay, as I mentioned earlier, when it was approved through the Balanced Budget Act under Medicare and Medicaid, the funding was established through those entities. And most individuals that qualify may have Medicare and Medicaid, but it's not necessary. If the individual has Medicare, then that is based on their number of conditions, how sick they are, how many diagnoses they have. So there's a risk adjustment factor there that's determined for how much of a monthly payment the PACE organization would get for Medicare to provide those typical services that would be covered under Medicare.
Okay.
And then if they qualify for Medicaid, that is established at the state level, and it's a fixed rate. It's adjusted annually, and it's based on an upper payment limit. So if an individual has Medicare and Medicaid, the PACE entity, once approved under CMS, would receive a monthly payment to provide these all-inclusive services for these individuals. And again, they include what's typically covered under Medicare and Medicaid. If they eventually do need to go into a nursing home and they are a PACE member, then the PACE is responsible then to provide payment to get them into a nursing home as well. So if an enrollee is with us, it's a voluntary enrollment process, and then they would stay with us until the end of their life, basically. But anybody who was enrolled could disenroll at any time that they wanted to.
Sure.
So currently now, most of these folks that meet this long-term care criteria are in a variety of managed care organizations. Well, PACE is one of those options if it's offered in their service area. So for this area, it hasn't been something that's been available, but hopefully once we go through all of our approval processes, it will be available, so it would be one of those options for the individuals that meet the criteria that we talked about earlier.
Great. So, I mean, we're getting close to the end of our show. And I just, last minute comments, or is there a phone number to get in touch with you at this point? Or I know we're talking about the future.
Yeah, basically we're looking at our timeline, hopefully that will be ready once we're approved to be ready to open up this summer of 2015. And in the meantime, just if anybody is interested in any information about PACE or about Beacon Health and Social Services, I can be reached directly at 732-806-3219. That's the simplest way. And it's just to gain information at this point in time. But that's, the plan is in place. The facility internally has been really completed. We're working on the external site work now, and hopefully, and working through all of our approval processes.
Which I understand, and that takes time. And
Yes.
so I'm excited, again, that you're coming and you're going to be in Monmouth County to provide these services, and that, again, SCAN will always hopefully be a good partner and be able to provide some of the social education and fun stuff that you might be able to offer there.
Absolutely, because again, when we talk about quality of life, and that's what obviously you're trying to do with SCAN as well, this population needs that too. And it really has, it's proven over time with these programs that it really has made a difference for many individuals, and been able to keep them living at home longer, which is really the goal.
Yeah, so I want to take this time and say thank you. I will take a short break, and we'll be back for some important messages about activities that are happening at SCAN.
Take it from me. Living with a chronic disease is no easy task, but I learned to better manage my health condition, and you can too. Take Control of Your Health is the chronic disease self-management program created by Stanford University. This fun, innovative course is now offered to all county residents. Diabetes, arthritis, heart disease, cancer. Take Control of Your Health gives proven strategies to manage these conditions and reclaim your life. See how nutrition, exercise, and various mind techniques can help you overcome depression, increase energy, and manage pain. You'll not only get this book when you participate, you'll also receive the guidance and support of others living with a chronic illness, just like you. Take control of your health in 6 short sessions.
Call the number on your screen to register or get further information at scannj.com. Brought to you by SCAN, Social Community Activities Network, with funding made available by the Monmouth County Office on Aging.
Welcome back. My name is Pat Bohse, host of Welcome to SCAN, and with me now is Andrea Tarr, the program director for SCAN. And welcome.
Thanks, Pat. It's always good to be here.
It is, and it seems like we have a never-ending schedule. So what is going on, and how is our luncheon in your estimation?
Well, we do have a never-ending schedule, yes. Our luncheon in October, as always, it was really wonderful. You know, Seabrook is the host. They treat us beautifully. They always put on a beautiful luncheon. And of course, it was wonderful. We honored some of our volunteers, some of our favorite volunteers. Donna, who's actually in the TV production class here at SCAN, and Jack Livingstone, who's been with us like forever, it seems, almost, I think, from the beginning, and he does a class in jazz and music.
Yes, and I just found out that he does these wonderful concerts in the library, so we are hoping in 2016 that he will be doing them here.
And he's been doing that for years, yeah. We're going to see if we can get him to do that. We also honored the Long Branch Chamber of Commerce,
who have become new friends of ours.
Yes.
And the two that I'm really excited about was our new our award in leadership of distinction for in the field of aging, and we've honored the 2 directors of the Meals on Wheels program, Cindy Sybil, and then also
we honored Sandy Silber, who is from the Interfaith Neighbors Meals on Wheels, and then Joanne Glassoff, and she does the Kosher Meals on Wheels.
So it was really exciting.
Yeah, so that was it was kind of great to have them with us. So that was fun.
And then our long partners, Monmouth Medical Center and the geriatric team.
Yes,
so it was just a really good event.
Doctors Israel Goldberg and Dr. Angie. Yeah, all have been wonderful friends to SCAN.
And they do a lot with us.
Yeah.
So I know that we have a brain health fair coming up on November 6th.
Yeah, we do, and this is our third.
Yes.
Our third annual. So that's really turned into a very exciting event, and I mean, I definitely encourage everyone who's listening to join us because, you know, it's an opportunity. I mean, it's fun. It is about fun, but it's just interesting to showcase different ways of stimulating your brain. Everything from, you know, puzzles to, you know, word games to puzzles to meditation and just different things that you might not think about that would be stimulating to your brain.
So it's not a lot of lecture. We only have an hour of lecture.
That's right.
And then we have 15 to 20 interactive stations where people can go play.
Right.
Both in SCAN and upstairs in the food court area of the mall. So a lot of things happening there, and it keeps growing every year. So we're hoping to have
it's a really great event. It has grown every year. So I definitely hope we'll see more and more people this year.
So what else is going on?
Well, you know, we've also just finished up our campus of courses, our annual Boscov's campus of courses. And again, you know, we've had record numbers of people coming into Boscov's in Eatontown. And we had many classes, we expanded to Boscov's in Ocean County. And because last time we did it, I mean, literally an overflowing crowd. So we actually had to put limits on it. Well, that was kind of good news. So we actually did it, instead of 1 day, we did it for 2 days, and it's really growing. So God knows what's going to happen next time.
And that's coming under the new division that we'll talk about at some point in time in regards to SCAN becoming the trusted resource or the information highway for seniors, caregivers, the general public, as far as educating them about entitlements, benefits, and fun stuff.
Well, because one of our most well-attended classes is always about entitlements and benefits for seniors, and this is generally done by the Office on Aging. And just judging by how many people show up at that class, it's clear that people don't know where to go for information. So I'm glad we're able to do that.
That's exciting. What else is going on?
Well, we're also getting ready. It's the time of year when the food bank, we do a lot of work with the food bank of Ocean and Monmouth County, great partners, and they are going to be doing a couple of things. There is going to be some open enrollment for health insurance, and then of course they will also be doing income tax work for us
In 2016.
in 2016. So this is the time of year when we're kind of getting all that information together. As soon as we have our dates, that we'll let everyone know about that.
And it's also the open enrollment time for Medicare.
For Medicare, that's
And
right.
so people should know that we do have counselors here.
Yeah.
They need to make a reservation and
Definitely.
appointment.
Yeah.
And they can find out how their plan is shaping up against others. So we encourage them to make their appointments early so that they can get
Right,
good information and
'cause
make good decisions.
That will also be a crush of people coming in, so definitely. And you know, we always after the campus of courses, we've had a lot of new members. So we should really give a big welcome to all of our new SCAN members. It's been great. We are growing, which I love to see.
Yeah, and we have a lot of new members from Ocean County who are requesting that we come to Ocean
Yes,
more often.
yes, yes.
So we have some good news for 2016. We'll be doing some stuff there.
We do.
I just really want to thank you and the staff for all of the hard work that you've been doing. It's usually registration time is terrible, but to the audience I want to say that we'd love to hear from you. Please come down to SCAN, take a tour, take one of our classes for free so that you can see what it's like. Everyone who's been here has been just very complimentary in regards to the warmth that they feel and the quality of the instructors that we have. So again, thank you very much, and hopefully we will see you soon, and we will again continue
Yes.
working and growing and all of that great stuff. So
We
what?
will.
Any 2 seconds last comment?
Come in and try a free class.
Yeah.
Tour the facility. It's
Okay.
we have a beautiful space.
So again, thank you.
How to locate SCAN. SCAN is easy to locate once you find the movie theater at Monmouth Mall. As you enter the parking lot from Route 35, the theater is almost directly ahead of you. Drive towards the theater, but go up along the left side into the parking lot. As you approach the end, you will see entrance number 3 on your right. Park and enter the building here. Once inside, you will see a staircase that only goes down. After passing through the doors at the bottom, turn to your left, and SCAN is right there.
SCAN, the Social Community Activities Network, has been serving the active adult community since 1988. Our main campus is conveniently located in the basement level of the Monmouth Mall, near the mall management offices. SCAN's affordable classes include physical fitness, computers, digital photography, Spanish, Italian, literature, art, music, TV production, and more. Also, Medicare resources and programs such as Take Control of Your Health, Financial Literacy for Older Women, and Brain Fitness. SCAN will be featuring trips and lunch and learn programs geared to complement your lifestyle. Visit our website, www.scannj.com, or call us at 732-542-1326, or visit us.